Healthcare seems to always be a contentious issue between access, funding, quality of care. Many Canadians worry about healthcare. Canadians expect to have reliable and quality healthcare when they need it. But with wait times increasing for specialists, tests, emergency rooms across the country over capacity, many Canadians are worried about the state of the system. And even though COVID seemed to usher in greater ease and access for both patients and doctors with virtual appointments, many doctors are feeling burnt out and underappreciated. And with the recent changes to the doctors' billing system in Ontario, some doctors have now seen that their per-visit fees are slashed when it comes to virtual care. On December 1st, Ontario introduced a number of permanent changes to its virtual care program that would see the fee paid to doctors cut from $37 per patient visit to only $15. So how will patient care be impacted by this change? Is virtual care actually helpful or harmful? What does healthcare delivery look like going forward post-COVID? Well, joining us now to unpack it is Dr. Michael Verbora, who's a practicing physician, chief medical officer with Alafia Health, medical director with Field Trip Health, and an assistant professor of medicine at McMaster University. Thanks for coming on, Dr. Verbora.
Thanks for having me. Appreciate it.
So perhaps you can start by unpacking what were the changes that the Ontario government announced recently?
So the changes predominantly are around the rules for billing for virtual care and then the fees associated with it. And as you highlighted there in the intro, a lot of family doctors who kind of slowly developed more specialized practices, they're probably the most affected because their fees are being slashed by about 70% unless they see patients in person first. And so the real challenge is it's not only just the fee slash, but it's also the amount of bureaucracy that is coming with it. So there's nothing worse as a physician than every contract every 3 years having more and more rules to follow, more ways of having to, contact patients and check who can see them, when they can see them, when you last saw them. So that just creates a ton of inefficiency in an already inefficient healthcare system.
So it sounds like a lot more bureaucracy, and I can't believe you have to redo that every 3 years. That sounds like a lot. So what was previously in place prior to this December 1st renegotiation?
Yeah, so I think you have to look at it from two perspectives. So someone like myself, I've been doing virtual for 7 years, and I started as an early adopter in the Ontario Telenetwork model. And the whole point of that model was to make sure people in rural communities had access to the doctors in Toronto, essentially. Let's call it as such. And then when the pandemic hit, the other 90% of doctors who weren't familiar with virtual started to do virtual just to keep people away from each other, to ideally slow the spread. So those doctors started adopting it, and the government introduced codes that were on par with in-person. So physicians got paid pretty much the same amount as in person or as virtual. Now, the new contract, I think what the government was concerned about is some physicians haven't gone back to the office as fast as they would like. And so I totally understand you need to ensure that physicians are available in person. But there's a number of patients now that are caught in the crosshairs of these new rules. So doctors like myself who've been doing virtual for 7 years, I have patients, I'm in Toronto, and I have patients from Windsor all the way to North Bay. And these patients are actually very, very vulnerable, very, very complex, on numerous medications, have treatment-resistant mental health problems and treatment-resistant epilepsy and other chronic illnesses. The problem with that is now it makes it very, very hard for me to continue to do virtual care for them unless they're willing to come drive 7-8 hours to see me for a 10-minute visit. And I've been seeing them virtually for 7 years. So that's a huge inconvenience for them. And they don't necessarily have the expertise required in their community. So it's an access issue now.
Now, one clarification. So you said that in order to bill at the higher rate, which seems reasonable, one has to see the patient first. Do you mean in person, or do you have to see them once in a year, or what's the requirement?
Yeah, so if you're a family physician doing some type of work outside of certain models, like family health organization models, you have to see your patient in person. And then for the next 2 years, you can continue a virtual relationship, which I think sounds pretty reasonable. Like, we should be seeing people in person. But the problem is if you've already built this virtual practice, because the government asks you to help them build this to ensure access for rural patients, it makes it very difficult for them to come down, 5, 7 hour drives just to do a 10-minute visit,
I agree.
only
I
to
have
be
to
able
pause you
to.
there. We got to cut to commercial. We'll be right back.